Welcome everyone to today's webinar entitled Challenges in Conducting Clinical Research in Resource-Limited Settings, Experiences from the COVID-19 Pandemic. We're so happy to have all of you on board today, and we'll hear from researchers who have conducted clinical research work during the COVID-19 pandemic and who've faced different challenges in terms of resources, logistics, and cultural barriers. To say a little bit about the coalition, this webinar is organized by the COVID-19 Clinical Research Coalition's Clinical Epidemiology Working Group. The coalition in itself was formed in April of 2020 by clinical researchers and scientists in response to the growing concerns about the impact of COVID-19 on health systems around the world, and that the COVID-19 related research priorities in low resource settings would not be adequately supported or prioritized otherwise. The coalition leverages global expertise to advance high impact COVID-19 research in low resource settings, including through its 12 different expert working groups. The coalition also advocates on the issues of concern to its members. We promote open sharing of research knowledge and data. And we also aim to champion equitable and affordable access to vaccines, diagnostics, and treatments proven to be effective. If you're interested in joining us or want to learn more, look for the links that we'll share soon in the chat. Just very briefly about myself. I am an infectious disease clinician and professor of global infectious disease epidemiology at Karolinska Institute in Stockholm, Sweden. I mainly worked with HIV and sexual reproductive health research in Africa and Asia in low and middle income settings over the past 20 years. But this past year, I've been heavily involved also in COVID research, and I'm part of the Swedish COVID vaccine reference group, and also part of WHO's independent allocation of vaccines groups under the COVAX platform. I am delighted to introduce the agenda, and today we have 4 distinguished experts to speak. Their expertise is at the intersection of clinical research, epidemiology, and public health practice, and they have worked in a range of different contexts. We will start with Professor Juan Carlos giving a background, and then we'll have Professor Jaap Boom talking about COVID-19 as a game changer for clinical research in low and middle income countries. We'll then hear from Dr. Stella Empagama, a professor at Denis, Javier, and then there will be a roundtable discussion and Q&As. So some housekeeping rules. Just a few. Today's webinar is being recorded, and a link to this recording will be posted soon after the seminar. But we really encourage you to ask questions for the panelists, and you can do that using the Q&A tool at the bottom of your screen. You can also upvote people's questions by clicking thumbs up on the icon for questions that you find particularly interesting or important, because we only have 20 minutes set aside for this discussion. If you would like to address a question to one of the speakers in particular, please make sure to include that speaker's name in your question. And when you leave this event, you will also be asked to fill in a short survey, and we would really appreciate if you could take a few minutes to do that. And thank you in advance for providing feedback on this seminar and for being here today. So, to start, I am really delighted to introduce Juan Carlos. He is a co-chair of the working group, and Professor Villar will also introduce us to our topic today. He is a Colombian internist with training in preventive cardiology and clinical epidemiology at the McMaster University in Canada. He has a vast experience of evidence-based medicine and health research methods. He's also head of the research center of the Fundación Cardioinfantil Instituto de Cardiológica in Bogotá, which is a referral hospital for cardiovascular disease. He has served as a leading investigator for Colombia in several international trials. Please, Juan Carlos.
Thank you very, very much, Anamia, and welcome everyone to this webinar. I'm saying hello from Bogota, Colombia. And I'd like to say that while we are all facing a pandemic, we have seen that responses and consequences across the globe vary by different factors. And we are about to discuss those issues, those different reasons, focusing on those aspects that are relevant for our countries, the so-called global south, those countries with more limited resources. We are going to see it by the experiences, the lens of experiences of very experienced colleagues. And so on behalf of our Clinical Epidemiology Committee in the coalition, it is a real honor to host this first webinar that we are having. But first, let us warm up with a couple of questions to know the audience and their beliefs first to start. So let me show you some poll questions. First of all, can you tell us what region are you in? And if you go down from your pop-up screen, you can also click on what is your work setting currently, please. Okay, hope everyone's seeing the pop-up window. So thank you. And so we have a very good representation from Africa. That's very good. And some from Asia. We are very interested in colleagues joining the committee from Asia. We have people from Europe, Latin America, Middle East, and North America. Very good. So next question is, I'd like to ask you, how do you see the research response? I don't see it in my screen now, but the next question I like to ask is to qualify, to rate what for you is the research response. I now see it. The research response to COVID-19 from low and middle income countries, depending on your expectations. So has it been far beyond your expectations, somewhat more than expected, what was expected, somewhat less than expected? Please tell us what you think. Waiting for the results now, in a sec. Okay, so most people think it was either on the expectations or somewhat below the expectations. Very, very interesting. So you're gonna see why in this webinar probably. So my last question is on what do you think the causes are? The most important factors to work on improving the low and middle income countries' research response can be, please rate 1, funding and resources, training and education, government and regulations, international collaboration, or tackling societal or cultural barriers. Please give us your thoughts. to see the responses here. Don't see it yet. A sec. So, well, more people think this is funding and resources issue. So I hope you are engaged now for this webinar, and please, Ana Mia, go ahead with the rest of the program. Thank you.
Thank you so much, Juan Carlos, for this introduction. I think it gave at hand that we do have participants with us from several low and middle income countries, which is really what we aim for. And I think the responses were interesting, and I thank you for participating. I would now like to introduce our second speaker, Professor Jaap Boon. He's the current Epicentre representative for Africa. This is the research arm of Médecins Sans Frontières, MSF. For the last 10 years, he has led several research activities of diseases affecting Africa, such as malaria, tuberculosis, HIV, Ebola, and now also COVID-19. Please, Professor Boon.
Thank you very much, Mia, for the introduction and for the invitation. So I'm happy to try to answer this question, whether the COVID-19 is actually a game changer for clinical research in our setting. And I try to do a poll, a bit like you did yesterday with my colleague, trying to figure out what they think, and we'll find in the presentation some of their feedback. I will quickly present what is Epicentre. Then we'll go deep on the issue of complex situation of the research in LMIC, and ask how we solve the question, research, yes, fact, and then some few idea of what could be next. So Epicentre is the research arm of Médecins Sans Frontières. We are operating globally, with offices in Europe, US, Middle East, in Africa. And for some specific kind of research, we rely on our two research centers. We have one in Uganda, this is what you were seeing down, and another one in Niger. But we also have research team in Cameroon, where I'm based currently, but also in DRC, in Senegal, or in many other countries. And as you can see briefly, as in some fruits of our labor, is that we adapt our research to the challenge and the diversity of those challenges that we face in the continent, most in Africa. It will go from malaria, tuberculosis, mainly in Uganda. We'll go to malnutrition and meningitis and diarrheal disease in Niger. And that will go from the prevention with the vaccine trial to the diagnostic and then the treatment. Next. Next slide, please. Okay. So we have different types of challenge: the simple, the complicated, and the complex. And this is a picture of the epicenter of the DRC Ebola 2018 Ebola outbreak. And you can imagine how complex it could be to implement a clinical trial assessing a vaccine in that environment. That will go from the finance, that will go from the logistic, that will go from the community engagement. Next slide. But at the end of the day, the Ebola experiment tells us that it is possible. Next. Small delay. Next slide, please. So now looking at Ebola and highlighting that we know we've been actually in those very complex situations. And those are some few evidence of research that was done, one, in terms of diagnostic to improve the capacity of detecting Ebola even in rural places. But moving toward the vaccine, now we have at least two vaccines, the Merck that has been used in many places for the last outbreak in Guinea and elsewhere, and the G vaccine that has been validated and actually evaluated by Epicentre in DRC. And also now we have treatment for Ebola. Now, when we move to COVID, we can ask ourselves what is happening. If do what I did yesterday, I tried to have an idea of the number of trials that are happening globally. There are almost 3,000. And when you look at Africa, a big black hole. You have South Africa, where you have a big green spot, where quite a number of research are happening, and you have Nigeria. So we can ask ourselves, is Africa part of how are we part of the research? Next slide, please. The challenge are numerous, and looking at the poll that you just did, more than 50% of the people attending the session are finding that the funding is the main challenge. But it's important to note that we've not have as much money as before for one disease, like it's happening for the COVID in all the country at the same time. However, there is not enough for LMIC. We recall the call for application that we did last year in Cameroon, for example, asking for a researcher to submit a proposal. And out of the 46 that submit and have an ethical approval, not more than 5 actually managed to get the funding. So there's a challenge because it reduced the number of studies, but also in Cameroon were not able to take place because of the funding. That is one of the reasons that the coalition was actually set up to find ways to accelerate the clinical research in our settings. Next slide. The second challenge that I will logistics challenge. Next slide, please. And by the logistics challenge, we all know that's one of the first time that such a disease was actually global, which means the human resource that are your researchers from the West that are used to come and supervise the research in the South, in the NMICs, were also busy with responding to COVID in their own country. And suddenly the border were closed. The good thing is that it was also an opportunity for researchers from the South to be more empowered and engaged, controlling the number of research that were happening. The other challenge to run the research is that we need a drug, we need a diagnostic, and we also need a vaccine when we want to do all those trials. And if you recall the time when we were thinking that chloroquine was a drug that was working, there was definitely not enough of those drugs in Africa. I took the example of oxygen as well, which is a challenge to be able to provide to the patient. And therefore, it's a limitation when you want to actually have a good research to follow the patient with COVID. Next slide, please. The third challenge that I'm mentioning, of course, the list is not exhaustive, is the cultural challenge. The first one being the community engagement. Where do we position our community in the research that we are implementing? How are we communicating them the benefits so that they can find an interest on what we are doing? The other challenge that we all know is the power dynamic between the North and the South. Who set the research agenda? The research agenda is set mainly, but not always, by the donor actually have the fund. And that's why some of the research interests, I took the example of traditional medicine, we have very few, if any, good research that have assessed during the COVID, the impact or the efficacy of traditional medicine in Africa, for example, which is a challenge. And then we can ask ourselves, what is the distribution in terms of role? Are researchers from the South being the implementer, while those on the North being the thinker? That is a challenge that we hope COVID will be an opportunity to change. We're studying the story. Who are the actual researchers publishing? Because those, the first and the last author, we know are the ones who actually tell the story. Where are we positioned? If we look in the past, and that review that I put here, we were realizing that not more than 30% of African researchers for research being done in Africa were actually first or last authors. The last challenge that I want to highlight in terms of cultural is the language barrier. Now I'm talking in English, which means that our colleagues from Niger who are part of what we are doing, or from DRC and many other countries, are not able to be part of this very important conversation. So that's also one of the challenges that it's important to highlight. Next slide, please. Beyond the challenge, I was asking the research we are doing, yes, but for which impact? And I will just take two examples. Next slide. The first one is that it's very important clinical trial of the efficacy of the vaccine, the AstraZeneca, on the South African variant, which show an efficacy of around 30%. That was done in South Africa. Just imagine if that study, what would have been the impact? All that population would have been vaccinated with a vaccine that has less efficacy. And then you can imagine the impact that it will have in the community, because we will have given them something that has no efficacy. It will have led to a lack of trust, considering all vaccine efficacy that we are seeing. So those are critical research that have an impact that will go as far as touching the politician, the philanthropist, so that they can understand what we are doing and invest more on the research that we are doing in our environment to solve our issue. Next slide, please. The next one is done in Cameroon by our team, looking at the performance of rapid tests for COVID. We knew from the beginning of this outbreak that it will not be implement PCR everywhere in the continent. So it was critical to have another alternative, but an alternative that is validated. So that's how we managed to assess the performance of those rapid tests, and eventually find an algorithm that allows us, as you can see in this picture, to bring the diagnostic to the community. Here, the test market, which means the people who are in that market don't have to leave the activity, but they can actually have access to the test. And those who are positive based on those rapid tests can then be managed by the district. So that is an important way to find solutions that respond to our own issue that might be different in countries where you can run 2 to 5, if not more, PCR per day. Next slide, please. Now, COVID have not eliminated all the other diseases. Next slide. And I will take 3 examples, a positive one. The first one is the yellow fever. While we are fighting against COVID, other people, including some of our team, were actually showing that the yellow fever vaccine, even if we use 1 out of 5 fraction of the dose, you can have the same immunogenicity. You can imagine the impact it will have during an outbreak like those that has been happening in Angola and other countries. It's important to highlight that behind the COVID, there are all those diseases still happening, and that those important research that are still happening. So all the fund should not go for COVID, but also being able to answer some other challenges. I mentioned also the issue of measles. Those outbreaks has been happening in DRC with less attention. And this morning I was reading the only clinical evidence of resistance to ACT that was found in Rwanda. So it's important to keep our mind open while during COVID, there are other issues happening, and we still need to make sure that we are tackling, because different countries have different priorities. Next slide, please. Next slide. Next. So what is next? What is next is definitely a list of more and more things that we have to do. We need to bring some change. Next slide. The first one is that we definitely need to think about decolonizing the global health. That's one thing. The second thing is to have more indigenous funding. We need to also have African countries to give the money that they've committed 20 years ago with the Abuja Declaration. We need more political will. We need to involve the African diaspora to also be part of those solutions happening in the continent. More community engagement about the multilingualism to make sure that we don't exclude people who are not speaking English. And of course, we will all agree, more money. Next slide. So to conclude, I will say that there is no one-fit-all solution for such a diverse continent. We have to find country-specific solution to make sure that the solution and the research, therefore, that we implement is tackling the challenge that they are facing in Sahel, which will be different to what we are seeing in Uganda or in Cameroon or in South Africa. Next slide. So at the end of the day, we can say that the COVID-19 is not yet a game changer. We need to do more. We need to do it together. Thank you very much for your attention.
Thank you so much, Professor Bohm, for that very interesting and I think thought-provoking presentation. And I hope this will generate some questions in our Q&A chat. So for all everybody in the audience, remember to post your questions there. Meanwhile, I have the pleasure to introduce our third speaker, Dr. Stella Empagama. She is a physician scientist at the Kibongawatos Infectious Disease Hospital and Kilimanjaro Christian Medical University College. Her main research interests are in development of solutions to clinical challenges for infectious diseases. Currently, Dr. Stella is building a clinical trial unit and developing a group of research scientists that will not only address tuberculosis, but also other infectious diseases threats in Tanzania. And she also obviously has a great interest in COVID-19 and the direct and indirect effects of this in her country. So please welcome Dr. Empagama.
Thank you very much, Anamia, for a nice introduction. I will highlight on the research governance to complement with what Professor Yap has highlighted as the challenges in conduct of researches in sub-Saharan Africa. I will go back in 2013 when we had Ebola epidemic in West Africa. Ebola epidemic is one of the diseases of biosecurity concern, and it poses a risk of international spread. And when Ebola epidemic happened, actually there was a lagging, the nations, West Africa and the international organization lagged behind to address the issue. So the Commission for a Global Health Risk subsequently created a comprehensive framework to guide international organizations and also countries to prepare themselves for the emergence of infectious diseases of biosecurity concerns. So this is a framework which was actually guiding how the United Nations should do, and also WHO and the others. So the United Nations actually created a guidance to support countries on how to prepare themselves for these kind of diseases. And of course, the UN tasked the WHO to create documents related to emergency preparedness, including a research and development plan. So there was this blueprint which created a clear framework on how to prepare for the diseases of emergence concern. And this was a proactive mechanism rather than being reactive when the issues has happened. And one of the recommendations from the Commission and also the WHO included is to create a list of priority pathogens every year to inform countries, industries, etc., and the researchers also, of course, to prepare for the, to predict and prepare for the infectious diseases of biosecurity concern. Unfortunately, in 2019, we have this COVID-19 epidemic, and you see COVID-19 is one of the fittest pathogen. It has spread almost in all countries in the world. If there are few spared, yeah, but most of the countries have faced this pandemic. Next. Now, in some of the sub-Saharan African countries, they have never experienced the challenges of emergence diseases of this kind. So to some of them, this was unexpected. They were unprepared. And some of the decision makers in some of the countries opted to think otherwise. They actually changed the agenda and they politicized it. And it was really less considered as a pathogen. And subsequently, this is spilled into some of the research governance bodies in such a way there was no action for the proposals which were addressing COVID-19. And perhaps this can justify in some of the areas where we see in Africa, there is actually blanks in terms of clinical trials which are conducted to address to address the issues of COVID. So the research bodies were actually perhaps one of the issues, that's why this happened, that there are no set principles and standards to guide you on how to address the research protocols related to this kind of diseases. And even in some of the protocols which included COVID-19 to address as a confounder, as in some of the recommendations, for now COVID is with us and we need to address it, it seems the proposals were not regarded. So generally, we see that we really need to strengthen the research governance, plus other factors which Professor Yap has already highlighted. So thank you very much. My time is up.
Thank you, Stella, very much. I would now like to introduce our last speaker before the Q&A session, Professor Denis Javier. He's the head of the Clinical Research Division at St. John's Medical College in Bangalore, India. He has developed research collaborations in about 210 centers across India and 2 other Asian countries. And to date, they have recruited over 115,000 participants in over 35 large clinical projects. So he's a very experienced researcher and has served in about 30 international steering committees for research. He's also an expert in research methods, biostatistics, and evidence-based medicine. Denis, please.
Thank you very much, Professor Anna-Mia. And thank you to this collaboration for the invitation to present this webinar. Right, I'm trying to move my screen. Okay, so I'm going to first give you a little context from where I come. So my institution is a tertiary care teaching hospital with over 1,350 beds. In addition, my group is a national coordinating center, and we work across the country in several large projects, and I've been involved in clinical research for 22 odd years. In this pandemic, we experienced varied situations related to research, and I'll be happy to share 2 perspectives, one from a hospital and research institute, and one from a coordinating center. We undertook a few COVID research projects, and also I will share with you our experience in other research as well. So a hospital so far has treated over 10,000 patients, and some of you keeping track of global changes in COVID, India's making the headlines for the wrong reasons. We are in the upstroke of the second wave. So sometime last year when COVID really began to hit us, we were initially overwhelmed. We were unsure. The treatment protocols were changing literally every week. There was a lot of fear even amongst us, clinicians treating patients. And from the patient's perspective, I mean, COVID is really terrible because, you can't have your family. One of the best things about the hospital, if at all there is anything good, is the evening time when there was visiting hours. Right, COVID took away that one good thing about a hospital: no family, no friends. So our healthcare workers, they were holding the hands of their patients, wearing the PPEs. So it was a terrible situation. What about research at St. John's? We have our own research institute, and in a very short time, there were 76 new COVID-19 projects, from trials to observational studies to registries, including later on vaccine studies. And all of them came up for expedited review. Our ethics committee was overwhelmed as well. There were several amendments to ongoing studies. And in our research institute, there were 200 studies ongoing, right from molecular studies to field-based studies to others. So several staff were affected. The lockdown that we had for over about 2 months, it hampered all of our activities. Some of them had to be left half done. Then few studies had to be stopped completely. Funding reduced. It picked up a little later. Several of our activities were delayed. So I'll focus now from our coordinating center, the Division of Clinical Research at St. John's, and I'll give you three perspectives. One is from the project staff, how we were affected, how the site staff and investigators at our over 120 odd sites, how they were affected, and a little perspective from the patients as well. So firstly, from the project staff. So in the 2 months lockdown, roughly that we had, people began to work from home, but that did not work too well. So after 2 months, we resumed, we came back and we continued to work from our offices. But that was not easy. There were challenges. Some of our staff had to be quarantined. The schools and creches were closed. So our staff found it very difficult to leave their young children at home and come to work. But we continued our activities. So in our research group, we did manage to close our 2 trials. We began 3 new trials and 3 trials were ongoing. There were several long online meetings like this. There was no travel. It was good for the wallet and good for the environment, but it was not good for the heart, not good for the soul. We couldn't do the refreshing things of going and meeting friends and collaborators. Right, remote trial monitoring happened, initiation and closeout happened, new activities we had to take, and there was a rapid learning process for us. From our investigators and site staff, many of them non-medical people, they were unable to reach hospital due to the lockdown and quarantine. Our investigators were on COVID duties, which is strenuous and exhausting. Some of our staff were COVID positive. All of them didn't have broadband for data management. Drug adherence was affected. Patients could not come to hospital, and patients also had other anxieties. Some of their loved ones were affected. We could not send drugs home. The couriers were affected, but it improved later on. The site staff were not involved or invited or welcome to patients' home. You're from the hospital. Oh no, maybe you need not come now. But we somehow managed to get there. So I'll conclude now on possibly a different note, a positive note. There were several challenges. A lot of it was affected. Luckily, many of them were overcome. And I would say roughly, although we've not measured it, overall, we caught up with about 75% of our activities. Importantly, positively, there were many opportunities. There was huge learning. The rate at which we initiated new activities was good. We modified our activities. And importantly, again, there was possibility thinking in spite of significant disruptions. So lots of challenges, but huge learning, and this taught us to look at things in a positive way. Thank you very much for this opportunity.
Thank you so much, Denis. So we have now heard from all the speakers, and we're moving into the roundtable discussion. I'm happy to see that several of you have posted questions in the chat that we'll try to answer. And I would like to remind you that that it is still possible to post questions throughout the session. So please go ahead. To start, we will now be joined by all our panelists. So I will just remind you to turn on your cameras, Stella, Juan Carlos, Jaap, Denis, so that all the audience can see you. And I would like to start with one of the questions, several have posted questions in the chat regarding Africa's COVID response and how it relates to other infectious diseases and challenges such as HIV, TB, and also lessons learned from previous epidemics, if that was helpful, but also to what extent perhaps lockdowns and the responses have made all of these other diseases worse. Sort of what is the balance between this? Lessons learned from previous epidemics, and to what extent sort of the response to COVID has made those challenges worse for the future. Stella, would you like to start saying something about that?
Yeah, thank you very much for this nice question. Starting from the lessons learned, yes, in our setting, in African settings, there are various. For example, when we had the HIV epidemic, we observed several countries, some denied, they entered in a denial phase. And later they agreed and we started the HIV, and now it's like a normal, we have organized the system in almost all sub-Saharan African countries. But for the COVID, it seems there is a same story which has happened in some of the behaviors which happened previously in some of the countries have been, those behaviors actually infect other countries, and there are some repetition in some of the countries. They started with the denial phase, denying that COVID exists, but also we see that there is some gap in research. Research has a lot of domains. Governance is one of the components, and also research leadership in terms of technical expertise, etc. For now, I think because there is a lot of investment which has been done to technical aspect for the last like 10 years, we can acknowledge mechanisms such as EDCTP, NIH, they are spending funding to invest in people. And the capacity, we can say there is some strength, but I think the issue is on the other structures, the governance structures. And when you say research governance, this relates to ethical bodies and the regulatory authorities. That has influence on ensuring that things can start or not start. So we've, the experience which we have gained this time, we have noted that there are some gaps in those governance because they delayed to make decision on how to go about these diseases of emergence concern.
Yeah. Dr. Boom, do you have a comment on sort of lessons learned from previous epidemics and whether, you know, the response to COVID have made these other burdens of disease more challenging for the future, and if research sort of are we researching the right things?
Yes, I will take just one example, which is Nigeria, and the experience we gained from responding to Ebola in terms of surveillance. I think it has been quite helpful for them now with COVID, and to the extent that they pushed to genomic surveillance. I think that's one of the countries that has really relied on looking at the different variants and how the virus was moving to include, I recall that they were realizing that the lockdown were not working perfectly because of the tracking that they were doing with the different viruses using the genomics. And that is a lesson learned from Ebola. I think quite a number of countries have learned some few things. That's something that we can improve.
Thank you very much. We have a question here regarding to Juan Carlos regarding how you mentioned funding as a challenge, and I think several of you did. How do we increase funding and resources allocated to research, to more resources to be allocated to research in low and middle income countries?
Well, obviously, the very first thing is to think of is the political will to really distribute the resources in general for the countries. Many of our countries have much less of their GDPs allocated for research, and there's always that struggle for those priorities itself. But on the other hand, there should be a lot more international availability and equity of research funding, considering things such as COVID, a global problem that should be tackled everywhere. So I think COVID is also a sort of a call to consider research on health in general a more global problem. Where the concept of nations and allocating resources for nations within governments is challenged to change, I think, for a more at least regional view.
Yes. Well, thank you very much. Yes, there is a challenge, definitely, when we see world economy going down and over 100 million people, 150 million people are expected to be pushed into extreme poverty due to sort of the world's COVID response. We see that GDP is going down in many of the funding countries and high-income countries, and that might also affect aid, sort of, and development aid and research budgets. So I just wanted to turn to Denis. India is really challenged by, the pandemic right now, or the epidemic in India. how do you think that will affect your India's investment in research over the next few years? Will it be sort of more or less?
Right. I wish I can tell you more, and that's the right one. But yes, India is a very diverse and an extremely complex country. But having said that, even just prior to the pandemic, research funding increased for both communicable diseases as well as non-communicable diseases. So it's a good sign as we just started off there. And there are many new kind of programs and schemes that came in. So things all moved or is moving in the right direction. But that's not sufficient is what all of us are saying. We need to do more, and we need to do more quickly. So that is from the government's point of view, and like many other middle income countries. So we are a middle income country now technically. There are other sources of funding that we also have to tap into, and slowly that is also happening. So things are moving in the right direction in India. To keep my response very brief, but what is happening is not enough, and it's not happening at the speed that it should. This is before the pandemic. Now with the pandemic hitting, the government is really strained. Although our central government did put in a lot of funding for vaccine research, for other research, setting collaborations and networks, and I've been part of some of these committees and some of these evaluations. So a lot of good things happen, but it should happen more and should happen faster. That's my wish.
Of course, I think we all agree with that. So thank you very much. Professor Boom, you have a question. There's a question here regarding registries. Sort of what is the state of registries, both for COVID-19 patients and sort of also the capacity, I think, to follow up the effects or impact of the potential vaccine rollout? Is there sort of capacity to do this? And that obviously also affects the potential for research in Africa. It's a question here.
Thank you. That's an important question. I'm looking at countries where we see different vaccines, the Sinopharm from China, the AstraZeneca, the Sputnik, and many of those vaccines. And there is definitely not only a gap, but a need to actually follow how those vaccines, with the efficacy and all the effect it might have in the African population. But I don't think there are many countries that are actually planning to have those studies and who have the funding. And I want to challenge ourselves as researchers. We are talking about political will, but it's also our responsibility to talk to the politicians in why they should actually invest more in research. If you look at what I present in South Africa, and now the researcher can stand in front of the president and say, because of the research that we've done, now you have not used millions of doses of AstraZeneca vaccine for nothing. So if they did not have that, then they will not have those findings. So it's important to find for each country how the research can actually have an impact in the community. I think that's when we will be in a position to impact more the political will.
Thank you. So yes, so you talk about political will, but also that actually the power of us as researchers and to push this development. And I wanted to turn to Stella there also, how you think that now when we see that many countries are actually turning inwards and becoming more selfish, not sharing knowledge, vaccines, equipment, all of this that we also see that many of the global organizations are sort of maybe not in their most powerful position to actually push collaboration across the world. How can we actually, as researchers, influence this? What could we do, you think?
Yeah, that is an interesting question. I can imagine when COVID started, initially we didn't sense that it will really change things. And we started with the lockdown, and some of the programs actually stopped. And some researchers, for example, me, I collaborated with a lot of people who are doing clinical works. So they were busy, went back to clinical works. And what I can interpret is that sometimes you may be in a position to help someone, But if you are hit with a certain level of crisis, you may even get like a frustration and go back to address your needs. So I see that is, because we also follow news, we see that it has affected a lot of things, and some of the colleagues get sick. So you can imagine you may even lose an interest of supporting other colleagues. So the way COVID-19 started, and this perhaps it's a lesson that we are all at risk when it comes in, this kind of diseases for which can spread elsewhere and pose the challenges. But because for the collaboration which is in Africa, as already Yap has mentioned, that the African countries don't put money, and there is a Abuja declaration which the countries have not implemented. So it means we implement research activities depending on funding from outside, from European colleagues and American colleagues. So when these things shake the economy and etc., it means people there will revisit their plans. There will also the effort, because the time which you can spend to collaborate and work and address these endemic issues, someone will need to go back at home and start contributing to the epidemic. Subsequently, there will be no time to plan, even for those the emergence which has happened, and they need to address their own challenges before. So it's a human nature. I can't say that the balance could happen, but perhaps we really need to invest on preparedness rather than waiting for the to be proactive. And yes, still calling for the African nation to invest so that we get a balance. We need to prepare before, we need to be proactive rather than being reactive. When the epidemic has already come, then we start trying to, it is not possible with this kind of diseases. So yeah, I hope I
totally agree with you there, Stella. And in terms of being proactive rather than reactive, you mentioned, Jaap, you mentioned that the closing of borders actually stopped some of researchers from the Western sort of hemisphere actually making perhaps more room also for Southern researchers to take initiatives and set the agenda. Is this something you actually see happening? And is this, how can we use this as a potential opportunity? And I think that also relates to several of the questions in the chat, how sort of researchers from low middle income countries to take a larger role in actually setting the agenda. What type of research do we want to do?
I think there is definitely an opportunity, because researchers has managed, I was talking about the call, for example, that was happening in Cameroon, but eventually, because no funds were available, they could not put themselves in the position to perform their research. Then it will be interesting for the donors to actually open funding dedicated for researcher and for idea coming from the low-income country, with maybe asking the PI to be only from those settings. And that will actually not only motivate, but inspire some of those researchers to make sure to feel that they can actually have the ideas to be implemented with some funding or even co-funding coming from the countries and also from the donors. I think there's an opportunity.
Thank you. And sort of given that this is a disease where sort of the elderly or elderly are by far the hardest hit by serious disease and death, and we know that in many low-income countries in particular, we have a very young sort of population that may be more at risk sometimes of the collateral effects of the pandemic. How do you think the sort of research agenda, would it change in any way in terms of topics we now research related to COVID if the agenda was set more by researchers from low and middle income countries themselves? Would it change? What do you think, Juan Carlos and then Denis?
I do agree with Professor Spom's view on the need to decolonize the research drive agenda and to have a lot more input for our own countries. And the picture I see is that while we sometimes have that input for the settings where we don't have much resources. And the irony is that where those sources for much better resources are linked to agendas that are driven by the higher income countries. So it's such an irony and the trouble that we face, and we need to bridge a lot more that gap. I think many of the new international foundations, coalitions such as this, are trying, do have a position to try to fill those gaps, and particularly in our committee, the first work that we have been embarking on have been to prioritize research questions, having our voices hopefully to be heard.
Yeah. Thank you. Denis, before you respond, I would like to bring up a question specifically to you also regarding research on misconceptions regarding COVID-19. How do you know of, are you aware of research regarding that in India and sort of in Asia as a whole? And is misconceptions with regards to COVID common in your view?
Yeah, absolutely. Probably you asked me to respond to two things, right? One is the misconception. Maybe I could do that second. And the first one is, our relationship with the developed countries and the the North-South collaboration, as we would say. So traditionally it was, the North, the global North coming and doing research for the South or on the South, if I may put it that way. So paradigms have to change. It should be with the South. So that could be one approach. The second approach is the South-South collaboration. And that is what is going to be enabling. And then, of course, at the outset itself, it's an equal partnership that we start with. And then once that strength builds, the South-South collaboration builds, and clearly the North with the global South, it becomes a more equitable partnership, and things can go better. So I have been asked before, how can we do this? So I think, and Stella said that very nicely, wherein we need to be, as a nation or a group of nations, we be proactive, we are prepared and not be reactive, and then then we're running helter-skelter because we don't know how to deal with it. So the way to do that, I would say, that there is, my view again, is a singular approach of enhancing research acumen, in the global South. And there are two ways to do that. One is, research training, start from undergraduate days onwards, and institutions providing the resources. By resources, I don't mean just money, providing the time and the priority for academics to do more research, and build healthy collaborations, academia industry collaboration, academia government collaboration, academia civil society collaboration as well. So we build research acumen, and then we become stronger, and then we are equal partners at the table. So that is one. And then, in the interest of time, I'll be very brief with the second one. Yes, there's a huge amount of misconceptions, not only what we would say the less informed people, to put it politically correctly, the less informed people, but also the well-informed people. As we look around, there's this WhatsApp university that goes around with all kinds of information coming in, and people believe immediately what they see. And these are well-read people as well. So that has to also be looked into in a proactive way, as to what information we are consuming, and then what do we propagate as well. And in emergency situations like this will have to be controlled very carefully. So thank you for that.
Thank you so much. I would like to thank all the panelists for attending, of course, but also to answering these questions, and for also like to thank all the attendees. We've had it in that webinar, which was way above 100 participants, which is fantastic, actually. And I would like to leave to Juan Carlos to make a few closing remarks.
Thank you, Ana Mia, for guiding us through this very nurturing discussion, and thank you to all the speakers today. Going back to the beginning, people thought mostly it was a matter of resources, but we have seen it's probably much more than that. We have learned on the huge need to work together, as Denis was saying, doing more, not only north-south collaboration, but south-south collaboration. A lot more work to do, not only multilaterally, but also in tackling very different aspects. So COVID is a huge problem and a challenge, but also is still an opportunity. At Professor Jabs was highlighted. So as I mentioned before, this webinar was organized by the Clinical Epidemiology Working Group. And as you see, we have a very diverse international group of colleagues interested in fostering clinical research in these parts of the world. You can find more information about our working group on the coalition's website, and we'll also post the link to our working group webpage in the chat. So on behalf of this group, we are thanking it, and we are looking to expand our membership, particularly in Latin America and Asia. So if you would like to join us, you'll also find the link on the webpage to ask for joining in the chat here. We have now come to the end of this webinar, and thank you very, very much for your participation and for your questions. The link to the webinar recording will be published on the coalition's website soon. And when this webinar will close, you will be directed to a brief survey. So please help us with your feedback, as doing that is very valuable for us and much appreciated. So thank you, and we'll see you in the next occasion. Thank you.